Welcome to EAC Speaks, the podcast where we dive deep into the movement to end the HIV epidemic right here in the heart of the South, Arkansas. I'm your host, Eddie Wiley, and together we're going to explore the stories, insights, and passion that fuels engaging Arkansas community's mission. Join us on this journey as we unite voices and take meaningful steps toward a world free of HIV stigma. Now, get ready for a conversation that matters. This is EAC Speaks. Welcome to EAC Speaks. Hello, everybody out there. This is EAC Speaks, where we dive into the latest happenings in the world of HIV prevention and treatment. Today, we're going to be talking about a groundbreaking approach to STI prevention that's gaining traction. It's called DoxyPEP. Now, if you're familiar with PrEP, which is pre-exposure prophylaxis for HIV prevention, you might already have an idea of what we're discussing. But DoxyPEP is a whole new tool in our arsenal. Especially as STI rates continue to rise across the country, it's more important now in October to stay safe and informed. And now we're going to talk about DoxyPEP. So in today's episode, we're going to explore the questions and everything that you want to know with insight from our special guest, Damon Jacobs. Whether you're curious about how DoxyPEP works, concerned about the implications of its use, or just looking to stay informed, this episode is for you. Now let's dive in and learn about how DoxyPEP is changing the conversation around sexual health and safety. But first, let's welcome therapist, advocate, author, and highly sought after speaker Damon Jacobs to the show. Welcome.
Thank you, Eddie. Oh, thank you for that introduction.
Of course. So we are super excited for this episode. Now, can you tell the listeners and viewers who may not be as familiar with the work, tell them a little bit about yourself.
Absolutely. So my name is Damon Jacobs. I am what's called a licensed marriage and family therapist in the state of New York, as well as the state of California. And I've been working in sexual health and HIV prevention in some capacity for 32 years now. And let me tell you, Eddie, this is the most exciting time to be working in sexual health and HIV prevention of my entire career. And here's why. When I started in this field, when we were talking about sexual health and HIV, it really was mostly focused on keeping people alive and trying to prevent the transmission of AIDS. We didn't even call it HIV back then. It was primarily AIDS. It was a lethal virus that if you got it, your chances of dying were quite high. We had no treatments and no way to help people stay alive and enhance the quantity and quality of their life once they acquired AIDS. Well, look how far we've come since then. In 1996, we had some incredible FDA-approved drugs come out that saved people's lives, enhanced the quality and quantity of people's lives. And then in 2012, the FDA approved PrEP to be used by people who are HIV negative to prevent HIV. And then we also learned around the same time that someone who has HIV, who's virally suppressed on medications, cannot transmit HIV. So we had finally all these ways for people to connect, love, have sex, and not transmit HIV. But the biggest objection and fear that came out of that whole beautiful experience was like, what about the STIs? But we still have all these STIs, and if all you sluts keep having sex without condoms with each other, we're going to have this explosion of STIs. And subsequently, there were rises in STIs, and it was often blamed on gay and queer men who are using PrEP and living with HIV, sexually active, who were being blamed unfairly. We could talk about the data that shows why. But being blamed unfairly for the exponential rises in chlamydia, syphilis, and gonorrhea throughout the United States. And it was like, oh man, it's like, well, we put out one fire over there, but we still have a rager over there. What do we do with that?
Right.
That's where I think our conversation is going to begin.
Yes. So for the listeners, we know that you're a huge advocate and you're also a user of PrEP, right?
Yes, so I began using PrEP for myself on July 19th, 2011. I actually started early because I was working in HIV vaccine research at the time and learned once the data came out that this pill called Truvada could prevent HIV by 99% without condoms. And I was like, oh, sign me up for that. So I started using it consistently since July 19th, 2011. As far as I know, I have been using it the longest or most consistently in the world, but people can tell me if I'm not being right about that. But it's now been 13 years of using, 13 years of slut.
Yes. When you said that earlier, I was like, hey, look, we do get a bad rap.
We do. But when I say slut, I say SLUT, sexually liberated using Truvada.
Aha. Okay, okay. I love that.
Yeah.
So now, yes, we are going to talk about DoxyPEP. Can you tell us what is DoxyPEP and explain how it works to prevent STIs?
I would love to, and I'm so glad we're talking about this. So, DoxyPEP refers to a medication regimen where someone would use a common generic antibiotic called doxycycline, and they would simply take 2 doses within 72 hours of a potential exposure to chlamydia, gonorrhea, or syphilis in order to significantly reduce the likelihood that they would then get syphilis, gonorrhea, or chlamydia as a result of that sexual encounter. Here's some
Mhm.
context. Doxycycline is an FDA approved drug that is considered safe and effective, has actually been in common use in the world since 1967.
Wow.
1967, so that's 57 years
Yeah.
that this drug has been in use for common ailments such as acne, malaria, bronchitis, gum disease, Lyme's disease. It's kind of a catch all because it is so very successful at killing unwanted bacteria in the body. So
Hmm.
much so that researchers started pondering this question in the early 2000 teens. Could this useful generic worldwide safe and effective antibiotic also be helpful in preventing the acquisition of sexually transmitted infections? And lo and behold, there were 2 major trials that took place in France in 2015 and 2017 that proved that yes, there are some clinical therapeutic benefits of taking this common antibiotic within a certain window after a sexual exposure that could significantly reduce the likelihood of getting an STI afterward.
Mm. That's so wild when you said the doxycycline.
Doxycycline. Uh-huh.
When you said that, I was like, I know this name, and it's from acne,
Right.
um, acne medication from my dermatologist. So yes,
Right.
57 years of this medication being out here, and now we're using it for prevention of STIs. So tell me, why now is DoxyPEP becoming such a topic of interest?
So what happened then was that we started to gather this data, and then folks like me who were talking about this, I facilitated a group online on Facebook, an international group where we were talking about PrEP and some of the data, the science, the information, and the facts, as well as the other methods that were there. The data was showing ways that we could enjoy sexual health and pleasure with minimal risk. So once the data started coming out about DoxyPEP, we started talking about it and discussing it in this international group on Facebook. Once I started learning about this data, I was like, okay, again, this looks really good to me as a harm reduction strategy. Sign me up for this. And I
Mhm.
started importing generic versions of doxycycline from a very common supplier internationally called the Dynamics Foundation, and started getting it myself in 2017 and just seeing, I wonder if this would work for me. Lo and behold, since 2017, I have not had a single STI when I've used doxycycline after a sexual exposure. I've had
Mhm.
quite a few STIs when I have not used
Mhm.
doxycycline, to be
Mhm.
honest with you.
Yeah.
And in 2015, I just kept getting them. Like there was this cluster, I just kept getting them. But once I started using doxycycline as the way the researchers were doing it, I stopped getting STIs. I stopped testing positive.
Mhm.
In UCSF, the University of California, San Francisco, they looked at all this evidence and data and said, let's see what would happen if we did a trial with the sluts of San Francisco and saw how well this drug might work in with Americans. So lo and behold, they did this trial. It went on several years. They published the results in the middle of 2022, and their data pretty much validated the data that had come out of France. That when people use this drug, use this regimen of this drug in this way, the likelihood of reducing chlamydia was about 89%, syphilis was about 88%, and gonorrhea was lower, somewhere around 50 to 55%. So that's lower, but it's still pretty significant that you could reduce gonorrhea rates by 50, 55%. Once that data was published in the US, that's when a lot of US providers and clinics and organizations started to rally behind it and advocate for the CDC to start providing practical guidelines and protocols for health providers in the United States to offer this to people who may be at greater risk of acquiring STIs during the year. Consequently, the CDC in the June 7th this year, or June 6th, finally put out provider guidelines, and it kind of legitimized the use of doxycycline to prevent STIs in the United States, even though it had been legitimized in other places. That's kind of why we've seen such a shift now in the conversation, and we've seen so many more gay positive and sex positive agencies and organizations begin to really advocate and speak up and openly offer this to their clients who are sexually active and at risk of acquiring STIs.
Mm-hmm. So this has a lot of implications on public health.
Yeah.
Now, what do you think are the potential public health implications of a widespread use of DoxyPEP?
You know what? We don't even have to speculate because we have early data to prove this. So in San Francisco, once this evidence came out, their sexual health clinics through the Department of Health throughout 2022 began a pilot program where they were started to offer DoxyPEP to anyone who was coming into the clinic who had been exposed to an STI or had been testing positive for STIs. They started to educate and distribute DoxyPEP widely within that population in San Francisco. And then they measured the numbers a year later, and they saw that offering DoxyPEP on a community-based level reduced STIs in their clinics by 50+%. I think it's 51 or 52%. So we have the data that shows that when you offer and distribute DoxyPEP on a community level to the sluts, again, I'm saying sluts in an affectionate way, to people who are very sexually active, without condoms, at greater risk of chlamydia, syphilis, and gonorrhea, if you make this available without judgment or stigma or shame, people will use it, people will take it, and your community rates of STIs will come down. This is a win for public health because, once again, doxycycline is safe, effective, generic, meaning it's not expensive, and it is so practical and easy to use. In community public health, we usually don't get wins like this, but one.
Now, I know that in any changes in public health, there's been maybe a little pushback or hesitancy. Have you heard of any like pushback from providers or community on DoxyPEP?
Oh, there is such pushback. There is such pushback. Most of it is based in morality, not medicine. Most of it is based in dogma, not the data. There is this reluctance in America, and it might be in other places, but I have seen it more in the US, that anytime we have advancements in sexual health and ways of enhancing pleasure and multiple sexual connections, especially when it's between men and anal sex, there's going to be widespread objection resistance in the medical community based on their moral positions, not based on the medicine. So here's what we see with DoxyPEP. We think it's problematic. We think there's not enough evidence. There's not enough data. And we're scared about some kind of resistance. They're always scared about resistance.
Right.
And it makes sense, right? Because we're always hearing in the media about like antibiotic resistance. That, Eddie, is disingenuous. And here's why. And you said it already. Doxycycline has been with us since 1957. It is commonly used all the time for acne. When you were given doxycycline for acne, how many doses did you take every week?
I think it was a cream or something. Was it? Yeah.
Well, it would have been a pill. It would have been in a pill form.
Oh well, yeah. I can't remember how many I took. It was so long ago, but yeah, it wasn't a
Every
big
day.
deal.
Was it maybe 1 day or 2 a day?
Yeah, no more than 2 a day.
Okay. So here's the thing. Most people who are given doxycycline for any of the things we've already talked about are typically told to take 1 to 2 pills a day. Now, that's 100 milligrams. So what that typically does is mean you're taking maybe somewhere between 800 to 1,400 a week.
Okay.
And that's, again, commonly been used since 1967 for all these ailments that people take doxycycline on and off for various reasons. When we talk about the use of DoxyPEP to prevent STIs, we're talking about only a dose of 200 milligrams. That's it, 200 milligrams. And then you're done. You're protected for the previous 72 hours. And then if you keep going and you're having more sex and you're, on vacation, you keep having more sex, you can take another 200 milligrams 72 hours after that. So what we're talking about with DoxyPEP at the most would be 400 milligrams a week compared to the 1,400 milligrams you'd be taking for all these other ailments. This is why I call false on all the panic and resistance fears, because y'all never worried about resistance when you were prescribing acne medicine to horny teenagers, or when you were giving people malaria prevention strategies when they were traveling to areas where malaria was prevalent. These are such common uses of doxycycline that are used all over the world. Again, 1,400 milligrams a week. But as soon as the sluts want to use it for butt sex, only 200 milligrams a week, they start panicking and fear-mongering and worried about all this resistance that doesn't exist. Yeah. So that's really been the greatest objection. And it was the same thing we saw with PrEP. I had hoped that we had learned some lessons from the history of the rollout from PrEP, how the greatest objectors to PrEP were the doctors who objected on moral basis. Again, Eddie, what I've seen over these 33 years and over again, what it comes down to is that there is a conscious or unconscious mentality objecting to gay men enjoying anal sex. And I think it's really that basic and that complicated, is that this idea of us loving and enjoying each other's bodies and sharing sacred seminal fluids is terrifying to so many people in the medical profession. And they are going to object and scream and parole clasp and oh my gosh, the whole way down. But those of us that are advocates and educators and consumers are going to keep pushing back on that and making this more widely known, which is why I love that you're doing this interview right now, because you're part of this.
Love that. And you have mentioned that moral versus medicine basis has been pretty much the same, you said, over the past 33 years that you've been in the field. And that's a shame that we continue to have to go through this, because it's pleasurable, it's enjoyable, it can save medicine for people who actually need it. So when folks actually have contact with possible STIs, this prevents that. This saves them from coming into your clinic and you having to go roll your eyes. So listen out there, providers.
Right.
If you are against DoxyPEP, get over it. People are going to have sex. That's one thing that is going to happen. Okay.
Right. Exactly. It works in the field. It works in the framework of harm reduction. It's not harm elimination, but that is true for everything that doctors provide. That is certainly true for COVID vaccines. That is certainly true for most forms of birth control. They don't eliminate risk. They just significantly reduce it so that our quantity and quality of relationships is much more vast.
Mm-hmm. So let's talk about access. Who has access to DoxyPEP currently, and are there any issues with availability, cost, or awareness that need to be addressed?
Well, so that really varies by geographic region. The drug itself is out there. I mean, again, it's been out there since 1967. It's accessible. It's not hard to make. It's not protected by a pharmaceutical brand. It's out there. Where people get access to it varies quite a bit. Now, I live in New York City, so there's a lot of access to it. I think the areas where there's a lot of sexual activity, a lot of proud activist sluts, LA, San Francisco, Seattle, Chicago, Boston, New York, Miami. There's these areas where I think DoxyPEP is being more widely distributed. But that then encourages and induces disparities in sexual health, which again is something I would like to try to avoid if we can, but it seems like it's already happening with DoxyPEP, that people who live in these blue areas get access to this faster and more consistently than people who live in rural areas. Or we know that in the South, that sex is still extremely stigmatized. Sorry, I know I'm speaking because you're in the South, but the CDC is telling us that 52% of new HIV diagnoses are coming from 9 states in the South. Mm-hmm. And a large significant number of that are young men of color, because they're not being given support, celebration, appreciation, empowerment to make sexual health decisions that are right for them. Instead, the situation is often medicines are not accessible, or if they are, often coming from doctors that are shaming and shoulding. And this is a systemic problem. And unfortunately, it seems to be playing out with DoxyPEP as well. The good news, the silver lining, at least for some, is that if you're PrEP and you're going through a telehealth provider such as Mister or QCare or Nurix or a lot of the PrEP telehealth providers are now offering DoxyPEP. So they're offering STI and HIV prevention together, like a peanut butter and jelly sandwich. They go together. It's a beautiful thing. And, I still say there's ways to just if you're in an area and you can't get it, it's still pretty cheap to order it generically online. There are ways to get it.
So how can we ensure those marginalized communities have access to this preventive measure?
Well, it requires us, all of us who are aware and compassionate, to get in there and educate the population, educate the community, share with your friends, share with the people in the bars, the clubs. If you can, see where there's a way to engage the community leaders that have influence and impact in the community. That can often be the entertainers, the bar owners, the drag queens, even the spiritual leaders can sometimes be involved in helping people to learn and understand all of the options that they have for sexual health, and to put it in a framework of celebration, not condemnation. When we get the community involved and engaged together, then you get people talking about it. You get people normalizing the conversation. And once you get community members, you get patients and consumers invested, it starts to then work its way up to the medical providers who then they got to change the way they practice or they're going to lose their practice.
Right. So now let's talk about the broader landscape. So we have all of the implications. We know that it's a great tool. Where do you see DoxyPEP fitting into the broader landscape of sexual health in the coming years?
Where I think this is going, and I think it's going to be easier than PrEP to do this, is saying that for sexual health clinics, if for no other reason than for fiscal responsibility, it makes a lot of sense for any Department of Health anywhere to include this as part of their package that they offer their patients and consumers who come in getting STI testing or coming in after an exposure to an STI. So let's say, I don't know anything about DoxyPEP, but I'm having this burning and itching in my penis, and I come into your clinic to say I need some help, and it turns out, oh, okay, Damon, yeah, you've got gonorrhea, so we're going to treat you for gonorrhea, and here's what we're going to offer you for future. We're going to give you this opportunity that if you think you've been exposed to gonorrhea, chlamydia, or syphilis, we're going to give you these pills. You can just, you don't need them today, but you can put them in your medicine cabinet. And the next time you suspect or a partner discloses to you that you've been exposed to an STI, you take these as soon as possible and then come back to us and continue to get tested on a regular basis. But it can be part of a normal sexual health practice. Again, women have been so instrumental in advancing using a pill to prevent an unwanted consequence of sexual pleasure. Women pioneered the birth control pill in the 1960s. So this idea of integrating a pill into sexual health and prevention is not revolutionary. We just have to continue to adapt it for people who need it.
So now I recently saw, you mentioned a letter. There was a new program from HRSA, which is like the big dogs that formed, that leads Ryan White, all of that. They recommended the ADAPs, the drug providers, to include DoxyPEP as a part of their formularies. What role do you see government agencies and healthcare providers playing in making DoxyPEP more accessible?
Well, in a perfect world, they'd be central to that. And ADAP is a wonderful example of how government can work, because ADAP does a lot of amazing work to help people living with HIV access drugs. Those drugs are very, very expensive, and ADAP is a government program so that people living with HIV in the U.S. have access to HIV treatment drugs that save their lives. First and foremost, saves their lives, and secondary, prevents HIV from being transmitted to HIV-negative partners. But the first part of ADAP is enhancing life and saving lives. So absolutely, government can play a role, and there is a track record of government stepping up and saying, we can do something helpful here. We can put whatever morality we have about this aside and simply look at the medicine, the science, and the fiscal data to show that we can save lives by offering this effective, safe drug.
Wow. So yes, we absolutely have to keep advocating for this. So I'm glad we have this episode. Now, let's talk to the folks who may be questioning DoxyPEP. How should someone approach their doctor with questions about the regimen?
Well, so some of the, I mean, again, thankfully now, as of June of 2024, the CDC does offer and support doctors to provide this. So if anyone is thinking about, I don't really know how to talk to my doctor about this, think about going to the CDC website, maybe printing out or bringing with you some links to share with your provider if they're not familiar with this. I am the first to say that I understand how uncomfortable it can be to have a conversation with your doctor about sexual health.
Mhm.
I am a 53-year-old man, and I really never had an honest conversation with a medical authority about my sex life until I was 40, till I started using PrEP. PrEP was the conduit by which I could start to be honest and reduce some of the shame and embarrassment I had about the fact that I like bottoming so much. But I had
Mhm.
never been able to talk about that with a medical authority figure before. I had always thought that I was going to be judged or, just lectured about condoms all the time or told, don't do that. So now that we have these invitations and innovations in sexual health, that's sort of the conduit for us to have more honest and open conversations with our medical providers about the power of PrEP, if that's appropriate, and the power of DoxyPEP to prevent STIs. And again, I think of it as just normalizing this conversation, again, as women have done for well over 60 years with birth control pills and various other forms of birth control that had been widely available since the 1960s and 70s. But often as gay or queer men or same gender loving men, we have carried the shame of saying, maybe you shouldn't be doing that. And I'm saying shoulds in quote because should is a word that I rebel against. But that's sometimes our thinking. You really shouldn't be having sex, and if you are having sex, you shouldn't be having too much sex, and if you're having too much sex, you definitely don't want to talk to an authority about it because they're going to shame and should you to death.
Mhm.
We all have the right to compassionate, science-based medical care. And that is
Mhm.
why I say, Eddie, we are consumers of medical care, not patients. Patients suggest the traditional medical top-down expert passive model where I am a doctor and I have all the answers and I tell you what you should do and you should listen to me. And if you don't, you're being resistant. No, the consumer model is collaborative, humane, data-driven. And if you have a provider that will not be collaborative and compassionate and data-driven with you, then as a consumer, you have the right to get your medical care from someone who will. Someone who
Absolutely.
will read the CDC guidelines, someone who will consider science, someone who will follow CDC protocol and prescribe DoxyPEP for you if you want it, you need it, if it's helpful.
Absolutely. I love this. So advocating for yourself and also, like you said, knowing that you're more than a patient. You should be a collaborator in your team, your healthcare team. You shouldn't just be a silent investor in your own healthcare. I love that piece.
Yeah, I think we learned that in America that you just sit there and you just listen and you do what the doctor tells you. In sexual health and in harm reduction, we take a very, very different approach to maximizing the quality and quantity of our experience.
Hmm.
And
So,
pleasure,
a
pleasure,
pleasure. Absolute pleasure.
focused. Yes.
Absolutely. I love that. Now, we've talked about DoxyPEP. Let's talk a little bit about you. What are some of the latest happenings with one of my favorite shows, Tub Talks with Damon? What's been going on?
Okay, so as you know, Eddie, so a few years ago, it was right around the time that vaccines for COVID became readily available, and people were starting to go out again, but sort of be afraid. We were in a very tenuous period. I've turned 50 years old and started to say, I live in New York, I live in Brooklyn, and wouldn't it be amazing if we had real, vulnerable, emotional conversations about where we're at today with people of all ages, all backgrounds, all races, all body sizes? Let's just talk about what we're thinking about, what we're hopeful about, what we're afraid of, what we've been through, and let's all do it naked in a bathtub.
Uh-huh.
And
I
so
love
I started this series called Tub Talks with Damon. And most of it is in my bathtub in Brooklyn, though sometimes on location in other places. And when I started this, I thought, okay, this is kind of crazy. I know maybe 10 people in New York that if I asked them, hey, would you come over and sit in my tub and have a conversation with me? They'd say yes. But I thought, no, there's no way most people are going to say yes to this. Lo and behold, 3 years later and 155 interviews later, I've had the blessing of talking to so many individuals who have wanted to sit in a tub with me and share with me the stories about their lives, sometimes survivors of trauma, abuse. Many New Yorkers who were here for the early days of the AIDS crisis, who has been through losing, their social group and ways that they coped with that. People who have been through breakups, makeups, people who have lost a significant partner, people who work in research and sexual health who are utilizing DoxyPEP. Victims or survivors of police violence in New York City. Just getting a range of human experience that we can talk about these things, but talk about them in a very intimate, vulnerable, naked format.
I love that. So tell the people where they can find TED Talks with Damon.
So just Tub Talks with Damon. Talks is plural, tubtalkswithdamon.com. That takes people directly to the YouTube page where all the interviews are up. I'm just starting season 4 as we speak. Getting ready to post season 4. Season 4 begins with a person named Carl Schmid, who's actually an ABC news anchor and was one of the first people to come out in 2017 as he had been living with HIV, but also really the first person to bring to the national media the U equals U message. U equals U meaning undetectable and untransmittable. That when you're undetectable, living with HIV, virally suppressed, you cannot transmit HIV to another person. Carl Schmid has been instrumental in bringing that to the American forefront. He's gone in conservative media. He was on the Megyn Kelly show talking about U equals U. And beginning season 4, which is going to go up in a few days, I think it'll be up by the time this interview goes up. He is I am actually in his tub talking about this with him in Los Angeles.
I love that. Can't wait to see that one, okay? Because I love hearing from Carl.
Yeah. Another interview that I'm really proud of from season 3 was with Tony-winning Michael Jackson, otherwise known as the living Michael Jackson, the producer-writer of A Strange Loop. I don't know if you've seen A Strange Loop, but if you get a chance, please see it in your area. It's touring now. It's a Broadway show. It won the Tony, and the producer wrote about his stories about living in New York City as a Black queer gay man throughout his 20s. He wrote a musical about it, sort of the loop in his head, the fears, the insecurities, the racism, the doubts, the body size issues that he had. He wrote about all of this, put it into a Broadway play. It won a Tony called A Strange Loop, and he's on season 3 of Tub Talks, and people can see that. That's in the archive right now. So I'm really proud of that interview too, because again, getting these messages out there into the world has been important for me. I have the privilege of going to a lot of conferences, activist conferences, scientific conferences, where researchers talk about data and numbers and DoxyPEP and PrEP and U equals U. But it's like we just sit in these conference spaces and talk to each other in an echo chamber. I wanted to get these conversations out there into the world in a naked bathtub so everybody could learn and benefit from this information.
I love that. That is amazing. So, folks, if you have not heard of Tub Talks with Damon, definitely get out there. Some of my faves have been on there as well. Now, as an author, can you tell us a little bit about your books, Rational Relating and Absolutely Shouldless?
Absolutely. So the other part of what I mean, kind of it's intertwined, but sort of the other thing I do in my everyday life is that I am a marriage family therapist. And I have written 2 books about the ideas and techniques and tools I use with clients. I was licensed initially in California in 2003, been practicing as an intern since 1996, and thought along the way, I have started to use some tools that have been used in favor of helping people feel better with less therapy. So my framework is cognitive behavioral therapy that has a lot in common with Buddhism. There's a lot of intertwine there. And a lot of the therapy and tools I practice are really about helping people feel empowered as consumers on their own outside of the therapy room. One of the most effective ways that I have found to do this is help people challenge and change the shoulds. The shoulds that are holding them back, that are causing depression, anxiety, anger, loneliness, substance abuse, isolation. so much of the despair and distress that we experience in our lives is related to the shoulds that we've got right here. And if we can begin to uncouple that and challenge and change some of those shoulds, that is conduit for living life in a way that is much more open and free and joyful and peaceful. So I wrote a book about that called Absolutely Shoulдлess that people can do. And then in Rational Relating was really based on my model of how relationships can be a conduit of serenity, joy, and pleasure. And a lot of that came from my therapy work, both in California and New York. And a lot of that came from working with polyamorous straight couples. Because here in New York City, I'm known for working really well within the straight community or bi community with polyamorous couples, being able to help create negotiations, agreements, compromises that are made with integrity and love and respect. So I wrote a book about that called Rational Relating, so that, again, anybody in the world could access these ideas and see how or if they fit in their own lives. You know, I feel like mental health and sexual health are a right, not a privilege. But the way medical care and mental health is set up in this country is it's more for the privileged that access it. So I would like to do whatever I can do to change that and make any of these ideas and tools and techniques for mental and sexual health available to anyone who wants them. Because for me, in my brain, we got sexual health and mental health are pretty much one and the same. When we have sexual health, when we feel agency, empowerment, and celebration in our bodies and our sexuality, that extends naturally to mental health. When we have mental health that is liberated and joyful and free and accessible in our own minds, that often lends itself to being able to explore the parts of our bodies that are available for pleasure.
Yes. You speaking to me now. I'm over here like I need to be more liberated outwardly. So let's talk about some of the things that you have coming up. Are there any things? I know season 4 for Tub Talk to Damon is coming up. Any new initiatives, activities you got going on?
So season 4 is starting in mid-September. September 2024, whenever people are watching this, so they can see this at Tub Talks with Damon. Next week, I am going to the U.S. Conference of HIV and AIDS, and I am on a panel of gay men over the age of 50 talking about sexual health and pleasure and what they mean to us. So I'm on a panel with 3 other men over the age of 50. The other 2 are in the age of 60. And we come to sexual health with different HIV statuses, different health abilities, but we're all talking about the beauty and vulnerability of sexuality at elder ages and engaging the audience in conversations with that. That is one of my favorite things to do. We've done this panel a few other times, a few other places. I love that. That's going to be in New Orleans next week. Something else I'm really excited about for those who have access is that it's coming up, and I don't even want to, I sometimes afraid if I say it, I'm going to jinx it. But I have been told myself and my partner, Rod McCoy, are going to be on the cover of a magazine called Positively Aware. It is a magazine that people often find in clinics, in doctors' offices, or HIV clinics. And we are the cover of the pleasure issue. So every issue has a theme. We've been asked to be on the cover of the pleasure issue because we're talking about we are an interstatus, interracial relationship, and we both address and celebrate pleasure and help other people learn about the abundance of connection, even when we are very different in different ways. So that is supposedly coming out in the middle of September, or late September, and it's called Positively Aware Magazine. Even if you don't see the magazine, you can still see it online at positivelyaware.com.
I'll be keeping an eye out for that. And I will also be in New Orleans. So if I'm not working our booth, I will totally be at that panel. I can't wait for New Orleans. I'm packing up. Tell the people where they can find you, like if they want to hit you up or want to blast your social medias all over.
Absolutely. So one of the ways we said is tubtalkswithdamon.com. Again, tubtalkswithdamon.com. Talks is plural. It's on YouTube. If you go to DamonLJacobs.com, don't forget the L, DamonLJacobs.com. That's my website. That's sort of the central location of the therapy practice, the books, the Tub Talks. It also includes a blog I wrote when I turned 50 called The 50 Lessons of 50, the 50 things that I have learned that have helped me get older with peace and purpose and pleasure. And again, just wanting to get these ideas out there, not wanting to just keep them in my head or in my therapy office, but talking about, or at least hoping to begin a dialogue where we can talk about aging in such a very celebratory way. So all of that can be seen at DamonLJacobs.com. And
Yes.
Google me. I'm like, I'm in, Google slut. I'm everywhere. So just Google me and I'm somewhere. Yeah.
Easy to find. So definitely, if you're interested in any of the things that Damon has going on, please don't hesitate to look it up. If you have questions, I'm sure Damon is around. You can book a session if you need to. Now, do you have any parting words for the listeners for this episode?
Parting words are: you're a consumer of medical care. Please think about what that means to you. Please get medical care with the idea that your body is a conduit of celebration and respect. And vote. Oh my God. Please vote as if your life depends on it, because it does. And please, if you want to, consider ways of helping other people vote. You can write letters, you can make phone calls, you can knock on doors, but please consider ways to help other people vote, because we need everybody to vote.
Absolutely. Well, David, we absolutely enjoyed having you on EAC Speaks. It's probably one of my favorite episodes to talk about pleasure and all of these things. And if you're out there listening and you would like to be a guest on EAC Speaks, please don't hesitate to reach out to us on our socials, on our website, via email, call us, beep us if you want to reach us. Until then, we'll say ciao. Say ciao, Dave.
Ciao!
The EAC Speaks podcast is partially supported by the Arkansas Department of Health through a grant funded in part by the CDC. All discussion is solely the responsibility of each participant and doesn't necessarily represent the official views of Engaging Arkansas Communities, the Arkansas Department of Health, CDC, or the U.S. government.